Hi, I'm Dr. Michael Manoj. I'm the Senior Physiotherapist at Care Hospitals, Banjara Hills, Hyderabad. I'm here to talk about physiotherapy guidelines after heart bypass surgery. In easy terms, CABG or bypass surgery uses a donor vessel to create an alternate and improved blood supply to the heart. The period of hospitalization after CABG is, on an average, 3 to 5 days. CABG surgeries have a long lineup. It has a long history. Owing to that, CABG has been constantly evolving. Traditionally, the sternum is cut completely and retracted. But much newer techniques like mid-cap surgeries do not involve complete cutting of the sternum, and even newer techniques do not involve the cutting of sternum at all. CABG procedures generally involve putting the patient on a heart-lung machine to create oxygenation and blood supply for the patient during the procedure. Now, when patients are being placed on heart-lung machine, it is generally called a on-pump procedure. Newer techniques have facilitated to limit the use of dependency on a heart-lung machine. Such procedures are called off-pump procedures. Patients generally develop additional fluid weight gain, fatigue, and may develop transient afibrillations also. But patients who have undergone on-pump procedures are more prone to developing these negative sequelae rather than patients who are undergone off-pump procedures. But this is not the only criteria on which your surgery is being planned. The surgery team plans a surgery after a rigorous and extensive assessment taken before your surgery. Recovery is somewhat slower after a heart bypass surgery. This is primarily due to the cost of healing. That is the reason your physiotherapist will be constantly monitoring your recovery and exercises after your heart surgery. You will be kept on a program of breathing exercises to improve your airway clearance techniques and all these things. You will be kept on unilateral strength training exercises to prevent pressure on your sternal wound and skin, and you will be kept on ambulation techniques as well. After your discharge, your physiotherapist will put you on a home exercise program. This home exercise program will be valid for 4 to 6 weeks. After 4 to 6 weeks of home exercise program comprising of the exercises which you have been doing in the hospital, it will be continued at home and you will be kept on a cardiac rehabilitation later. Why are you developing fatigue after heart surgery? You are developing fatigue after heart surgery primarily due to the energy that has been used for wound healing. That is the reason your energy expenditure has to be kept into account. It is very wise, as a physiotherapist, we advise patients to keep this point in notice. That is that doing few repetitions throughout the day is much better compared to doing 1 to 2 rigorous exercise sessions in your house. Also, your energy should be conserved because your energy should be treated like currency. Because most of your energy will be taken towards wound healing and recovery, you have to divide your day into sessions of rest, sessions of activity and periods of leisure as well. Please consult our physiotherapy department at Care Hospital for a better overlook into your physiotherapy program. Also call us and visit us as a physiotherapy department for your cardiac rehabilitation as well. Thank you.